What if paralysis wasn't always permanent? For decades, spinal cord injuries have been among the most difficult conditions in medicine to treat. When the spinal cord is damaged, communication between the brain and the body can be interrupted, often leaving patients unable to move parts of their body. But researchers around the world are exploring new ways to restore that connection. One of those researchers is Brazilian doctor Tatiana Coelho de Sampaio, whose work is bringing new attention to the possibilities of spinal cord recovery. During Women's History Month, it is important to highlight her research as both the future of medicine and the important role women continue to play in scientific discovery. To understand why this research matters, it helps to understand the problem. The spinal cord acts like a communication highway between the brain and the rest of the body. It carries the electrical signals that allow us to move, feel sensations, and control many bodily functions. When the spinal cord is severely injured, those signals can no longer travel normally. For many patients with paraplegia, this means losing movement and sensation in the lower part of the body. For decades, doctors believed that once these nerve pathways were damaged, recovery was extremely limited. But modern neuroscience has begun to challenge that assumption. Dr. Tatiana's research studies innovative approaches aimed at helping patients with spinal cord injuries regain movement. Her work focuses on therapies designed to stimulate and retrain the nervous system, encouraging the body to reconnect damaged neural pathways. In some experimental cases, patients undergoing specialized treatment programs have shown signs of regained movement or improved neurological function. These results are still part of ongoing research, and scientists continue to study how these therapies may work and which patients may benefit most. But the findings suggest something remarkable. The nervous system may have more potential for recovery than scientists once believed. If therapies like those being studied by Dr. Tatiana continue to show promise, they could represent an important step forward in the treatment of spinal cord injuries. Such discoveries could influence several areas of medicine, including neurological rehabilitation, regenerative medicine, neuroplasticity research. The idea that damaged neural pathways might be retrained or restored has become one of the most exciting areas of modern neuroscience. As with any medical breakthrough, further research is essential. Scientists must continue conducting clinical studies, validating results, and understanding the long-term outcomes of these therapies. But each new discovery helps expand our understanding of the nervous system and its ability to adapt. And researchers like Dr. Tatiana are helping push that frontier forward. Stories like this remind us that the future of medicine is still unfolding. Breakthroughs often begin with scientists willing to question what we once believed was impossible. And in laboratories and research centers around the world, new discoveries continue to reshape what medicine may be able to achieve. So the question becomes, could advances in neuroscience one day transform how we treat paralysis? The answer may depend on the discoveries still ahead. Thank you for watching. See you next time.